Congressman Rodney Davis of Illinois. Congressman, you support the latest GOP health care bill. You are also a member of the Moderate Tuesday group. I've taken a look at this thing. By my estimation, it appears to be the same very unpopular repeal bill, except, of course, insurance companies can jack up their rates if you're already sick. How is this a good idea?
No, I don't see that. We think we've got good policies that are actually going to provide the 29 million Americans who still, under the current plan of the Affordable Care Act, do not have health care coverage, and the 31 million more Americans that can't afford to use the coverage they have. Stephanie, I was a supporter of the first bill because I believe we have good policies that are going to achieve those goals. This amendment ensures that the federal essential health benefits, like covering pre-existing conditions, mental health treatments, maternity care, are going to remain unless a state decides that they can achieve those same goals of lowering costs, providing accessible coverage, and doing it with the state legislature passing a bill that's going to achieve the same goals that the essential health benefits do.
So, sir,
remember, Stephanie, states regulate health care coverage right now, and states are the ones that are going to ensure, and many states like mine have tougher EHBs than what we have at the federal level right now.
But correct me if I'm wrong, does this not give insurance companies the opportunity to jack up their rates on people with pre-existing conditions? Because insurance companies' stakeholders are their employees and shareholders, not the American people.
The answer is no. No waiver can be given unless certain goals are met, certain criteria are met, and an invisible high-risk pool has to be set up, like is working very well in the state of Maine, where those with pre-existing conditions don't know that they're even in the high-risk pool. They're paying the same amount as those who don't have pre-existing conditions. That has to be a part of any waiver request. And remember, each state legislature is going to have to pass a bill to require that many of the goals are being met, like lowering the cost of coverage, providing accessibility. We believe our bill will continue to provide pre-existing condition coverage to every single American. And that's personally important to me because my wife is an 18-year cancer survivor.
Well, then other Republicans, other moderate Republicans, why is it that they're not yet on board? And I'm glad to hear that your wife is an 18-year cancer survivor. That is superb.
Well, thank you, Stephanie. I don't know why many of them are not on board, but remember, there were many Republicans of all different philosophies that were no the first time the bill was up, which is why the bill was pulled. We're hoping that this common sense amendment and other amendments that I'm sure are likely going to be introduced are going to help us get this bill to the Senate so they can do their legislative work on it too and send it back to us.
But what about the other Republicans that you do know? I'm guessing you have to be having conversations with other members of the Tuesday group. Those who are not on board, why aren't they? What are they telling you?
Well, there's a wide variety of reasons why people don't support this bill or many other bills. And I don't speak on behalf of the Tuesday group. I'm just speaking on behalf of myself and my constituents. But many of my colleagues have had concerns with the initial bill because it affects their state differently than it affects mine. And that's the legislative process. That happens on every major piece of legislation we have. But we can't forget the facts. The facts are that 29 million Americans right now still don't have health care coverage when the law requires them to. 31 million Americans have faced astronomical premium increases and have deductibles that they can't meet because they can't afford to use the coverage they have. Even Bill Clinton just a few months ago, Stephanie, said this was a disaster. We have to do something to help them.
Without a doubt, this thing needs to be tweaked. How much, honestly, pressure are you under from the White House to get this thing through off your plate, move it to the Senate, to give the White House a legislative win? Because, frankly, there isn't one in the first 100 days.
I haven't felt any pressure from the White House. They've been very good to work with and very open to many suggestions. And I have to actually thank President Trump, Vice President Pence, Reince Priebus, and those who have worked with us to come up with common sense solutions to make this better. There's no pressure. It's actually discussions, and it's something that I didn't have during my 4 years with the previous administration. So we're working together to achieve those goals that I mentioned to help those 60 million Americans, and I know the President and Vice President are trying to do the same.
All right. Thanks so much for joining me this morning. I appreciate it.
Thanks, Stephanie.
All right. Now